Good morning, I'm Julio Saenz along with Mauricio Riveros. Today we'll meet Lois Irwin, president of Easy Access MD, which brings urgent care services to people's home and work.
We hope you will be inspired.
Celebrating leaders in Rochester's unique and vibrant business community. We'll meet entrepreneurs whose passion and perseverance have helped push through life's challenges. Join us as we share their stories and journeys to success. It's time to be inspired.
Hi, Lois. Thank you very much to be inspired. It's a show that we developed to interview different type of businesses, entrepreneurs, people who are doing great things in Rochester. And today we have the honor to have you in this show. But let's start talking. Who is Lois?
Thank you for having me, Maurizio. It's a pleasure to be here. So I'm Lois Irwin, and I'm a product of upstate New York. Grew up in Ithaca, went to college there, and a few years later, after working in some other places, landed in Rochester. And I'm proud to say, and very kind of interesting the way the world works out, when I graduated from college, like many young people, I wasn't exactly sure what my role in the world was going to be. I wanted to save the world, but I wasn't sure how I was going to do that. But I did end up working in West Africa for a couple of years at a mission hospital. And my role at that hospital was to help them build their first ever mobile clinic. We had a van and put equipment and people in it and drove to very remote villages that were too far for the people to walk to get care. And every day went to a different village and delivered healthcare. So that was the beginning of my journey in mobile healthcare. And here I am all these years later, still in mobile healthcare with some detours along the way. So when I ended up in Rochester, I was first working for a large company for Xerox for a number of years. But then met my husband, and he had just purchased a mobile diagnostics company called Ultramobile Imaging that delivers x-rays and ultrasounds to frail elderly people all around the community and the surrounding counties, mostly people who are in nursing homes or independent living, and helping them if they've fallen, might have broken their hip, needed an x-ray. So we built that business, and I really loved it. There I was back in mobile healthcare again. And about 6 years ago, we saw an opportunity to take what we were doing for older people and bring it to the under 65 population in our community. And that led us to the realization that most healthcare in not just Rochester, but in the country is actually purchased by employers. They make the arrangements for your healthcare that you probably pay part and they pay part, but they figure it out. So that's when we realized we had a path for employers to bring our service to the under 65 population. So that's just a little bit about my personal background. One other thing I'll say is that my grandmother, also from upstate New York, was a registered nurse. She graduated from Krause Irving Hospital nursing program in 1917, just in time to treat patients in the epidemic of 1918, the great influenza epidemic. So she always told stories about that time and how hard it was. And I listened a little bit, and you know, she's long gone now, but I have to say, I never really appreciated it until we had our own pandemic on our hands and gained an appreciation for what my grandmother must have gone through.
Wow, what a story, Lois. Really incredible. And now here we are in the middle of the pandemic. We were in last year, and you guys were playing a huge role in terms of helping the community and be there. So tell us a little bit, what was that experience as a service, as a provider? Actually, I received your service. I got COVID, and I was able to really get your service from my house, in my house, and was an incredible service that you provide. So tell us a little bit, what was the participation of your organization during that hard time that we were suffering during 2020?
Sure. So prior to the pandemic, we had built out a telemobile health service that brought mobile diagnostics to patients' home, employees of local companies. And we had grown that business. So we had a good foundation, a good infrastructure where we could go to a person's home. And at that time, we were doing things like a lab test to see if you had the flu or a strep test, as well as x-rays and ultrasound exams. So we had that infrastructure in place, and it was all on demand. We can be anywhere in the 9-county region in under 2 hours to deliver that care. So when the pandemic started last March, as the manager of the business, the first thing we had to do was make sure that our own employees were protected with PPE. And that was a little trickier than it had been previously. So we focused on that initially, but got great support from the county and the state in getting that protective equipment that we needed. And then once we had our employees protected, knew that we were in a position to help with COVID testing. So you recall that was the first challenge, was to get testing done, and testing was hard to come by. So I reached out to Dr. Mendoza and offered our service. I said, we have an infrastructure that we'd like to help. Tell us how we can help. We're here for you. So as a result of that, we worked with the county and health department, and they dispatched our team to do testing in populations that had a hard time accessing the testing. So for instance, we went to homeless shelters, we went to migrant camps, we went to a lot of congregate living situations, group homes, and other places where people lived at the direction of the county, and were able to help a lot of people get COVID testing that way, using our infrastructure. And at that time, the supplies from the county, the COVID test supplies were hard to come by. They were limited. It was a scarcity situation. And then as the months unfolded, eventually we were able to purchase some test supplies for our customers, for the employers and their employees who were using our service. And we were able to add COVID testing to the things that we could do for them in their own home on demand. And we were actually the first company in the country to offer free in-home rapid COVID testing last year. So that really illustrated the value of the infrastructure, the capability that we had put on wheels that we could bring to people's homes, and how great to be able to offer that service during a pandemic. And then for patients who unfortunately had COVID, we were able to help them with more diagnostic testing, because they needed often a chest x-ray so that the doctor could see what was going on inside lungs. And I'm glad that we were able to help you and your family in that regard, Mauricio.
I have so many questions. This is just such a great service, and really proud that it's based here in Rochester. Super impressed. So I have a 2-part question, just because I say I have so many. First of all, what geographic area does your company cover? And then if I was a business owner and I'm in that geographic area, how would I reach out to you directly, or do I go through like my insurance provider? How do you get to work with you guys?
Yeah, great questions, Julio. First, in terms of our geographic coverage, when we started, we were very proud that we offered our service in 9 counties. We have now grown to other states. Our first expansion state was Tennessee, and we are now offering our service, our mobile services in 22 states around the country, and our goal is to be in all 50 states. So that's our geographic scope. And in terms of getting our service for your company, there are 2 ways to do it. You can either reach out to us directly, or you can work through your health insurance broker. And they may know of us, and if they do, that's great. And if they don't, please tell them about us and ask them to call us. We have a great partner program with the broker and advisor community, because they can certainly reach more businesses than we can on our own.
Well, thank you, Lois. We'll be back with more after these messages.
What an interesting experience, and really the growth of your company is significant, and congratulations for that. Now, technology is changing everything, and I know you guys were kind of the innovators in this. And one of the things that I see constantly now is applications, apps, things that, you know, in the technology people can get access. What is the level of development that you have in terms of applications and things like that that can easy access to your clients to the services that you offer?
Right. Well, I'm glad you asked that question, because we actually do have an app for our service that's available for anyone for free on the App Store or Google Play. Of course, you have to be a subscriber, so your employer has to have purchased this service for you. But once it's there, it's easy to download. You don't need a password, a username. You don't have to enter a credit card to use. You just open it, and when you want to talk to a doctor, press consult now and place a call. So we've tried to, as access is our middle name, we've tried to make the access as easy as possible. And this is probably a good time to say that this service is always totally free to the employee. So there's never a charge to the employee, and it includes their family members as well. And it's paid for by the employer, who has many financial benefits, not the least of which is fewer hospital claims and urgent care claims that they have to pay on their insurance. So there's a trade-off there that works well for the employers. And then in terms of other technology, I think maybe you were referring to things like wearables. So people can wear a watch now and get their EKG that way. And I think everybody's imagination is spinning, well, where is that going to go next? And so on. And of course, we hope that there will be more and more. The better data that you can put into the hands of your physician to diagnose your condition, the better off you are. And it's certainly a very efficient way for healthcare to operate. So we endorse those and support them. However, our service, where we come to the home, will still be for those situations where there is some level of hands-on, I'll call it care testing required. So for instance, an X-ray machine, most of you have probably seen them in a hospital. They're pretty big and clunky and heavy. We have ones that we manage to fold up and collapse and put in the back of an SUV, and then unfold it and bring it into your home. And an X-ray machine generates radiation. So that's something that we don't see being put in the hands of consumers anytime soon. It's a highly regulated, by necessity and for our public safety, controlled equipment operated by highly trained technologists that we're sending into your home. So that is, kind of one of the differentiators of what might happen in the home, and what can happen by an individual. We are constantly on the prowl for more, better diagnostic testing that we can bring to the home. On the horizon, not quite yet here, but we're doing a pilot in another state, is a blood analyzer that can be brought into the home with results immediately provided. That's the hallmark of everything we do. When we come to the home and do a test, we don't take a swab and then pack up the swab and drive it to a lab and wait 2 days later to get the result. We bring the processor into the house, process the swab right there, get the answer in 15 minutes. So we are all about getting the testing information quickly into the hands of the doctor so that you, the patient, can get your diagnosis and your treatment plan, any prescriptions that you need within a few hours and be on the path to health. But yes, we're excited about where the future of technology can take us, as well as the individual consumer.
Fascinating. And I have a question for you that I often hear many of the guests that we have on the show week after week, when we ask them about their vision for the future of the company, they talk about regional, even expansion to other states, and you've done it and done it so well. What advice would you give to folks who want to do that in the future, and maybe what drove your decisions to expand to different states? Was it the market conditions? Was it the sunny weather? What was the determinant behind some of those?
Yeah, that's the first time I've been accused of going to Tennessee because the weather's warmer, but we do enjoy traveling there. So a couple of things for entrepreneurs, and I can speak from our experience of how we did it. We were very fortunate as we grew our business here in Rochester to get to know other companies who diagnostic testing in communities all over the country. So we saw, we could partner with our friends in Chattanooga, Tennessee, and have them deliver the same care there that we're delivering here. Our role will be to create a network and bring all of the pieces together in a national network. And frankly, I see that happening in other industries and by other entrepreneurs, realizing that there's power in bringing people together who have like interests, like capabilities, that you can cooperate and be stronger by cooperating than competing. And as an entrepreneur, we can leverage infrastructure that's already there and eager partners who we're bringing growth to them. So that's how we have been able to grow our business through these partner relationships. And I think, I can think of other examples, or there's many example kind of platforms that are being built that integrate capabilities of different organizations into one offering to a consumer or a customer.
Well, we just have a couple minutes left, but I wanted to ask you talked about how your company rose to the occasion to help folks during COVID. Do you see any changes to your business or to the industry that are going to hang around or link here to stay because of COVID?
Well, unfortunately, I think COVID testing itself is here to stay, because when your physician is trying to diagnose you, if you present with a cough, let's say, and it's September, they are going to have to figure out, is that the flu? It's a cough. Is it strep throat? Is it COVID? So we're expecting that on an ongoing basis, that the COVID test will be part of a panel of tests that we will be asked to perform. I don't want to say forever into the future, but for quite a ways into the future. So that has certainly raised all of our understanding of respiratory illnesses and made us realize how can we bring more to our platform, our testing platform, and bring more capability and be nimble when the health conditions in particular change.
Lois, thank you very much. We have really learned more about your services, and I can be a witness of that. Definitely, in my case, your services helped me. It was a very particular situation. The x-rays came and they identified early the situation with COVID, the medicating through the phone, the doctors were there, they were doing the follow-up, and it was an incredible experience. And I personally believe that you guys are innovating and bringing this to this level. So thank you very much for what you guys do. Thank you for helping our community. And I am sure that we will have you in the future in our show and to learn more about the progress and the growth of your organization. Thank you very much.
Coming up next week on Be Inspired, we'll meet Maribel and Matt Honeyford, owners of Honeyford Real Estate, and learn how they started their own commercial and residential real estate company.
To watch today's episode and the complete interviews of our guests, go to rochesterfirst.com/beinspired. For more great talk with Rochester's entrepreneurs, listen to Bodette 97.1 Saturdays at 9 a.m. For Mauricio Riveros, I'm Julio Saenz. We'll see you next week on Be Inspired.